And we are live, Senators.
All right, this is Senate Health and Welfare. We're back live and we are going to be listening to folks who are giving us very short window into their budget requests. I've asked the folks who were not funded in the budget, who had made requests or who feel that they were significantly underfunded and made requests in the House. This is just the first of another conversation that we will have next week regarding what's in the budget that relates to our areas of jurisdiction. So I'm asking each of you to be succinct, and Alex is the timekeeper for this, so he's going to keep us all honest. So Jessa, please come on. And our committee will be listening and not asking questions unless there's something really critical.
Hear that, Dave?
Great, thank you. Good morning. Jessa Barnard with the Vermont Medical Society, and you should have written testimony from me as well. I'm here on behalf of our physician members of VMS, also the family physicians and pediatricians. Our first item is funding for the Blueprint for Health. And I know you had an introduction to the Blueprint from John Soroyan earlier this session. There was a proposal in the administration's budget to fund a 2-year pilot expansion of the Blueprint for community health team staff. These are the individuals like community health workers, social workers, or counselors who cope with screenings for social determinants of health, referrals, and care coordination. These are really supplement the existing primary care infrastructure and physicians and nurses who work within the practice to help make sure that patients' needs are met. And it would also expand the number of Dulce family specialists who screen and refer families with newborns. And it would expand Dulce services around the state rather than only in some locations. The House funded 1 year of the pilot program rather than 2, which was the original proposal. And we just have concerns. We're participating in a number of work groups around getting this expansion started. And it's really not, especially given the timing of the budget cycle, not going to get off the ground till July. And we're worried that that would give limited time to gather data and evaluate success before reporting back to the legislature. There'll really only be a couple of months. And so we ask you to support the original proposal, which is a 2-year pilot rather than only 1 year of funding. And I do just have to mention, I know this is in the House recommended budget, but we are strongly in support of what is in the budget currently to increase the Medicaid rates for FY24 for the professional medical services or RVS fee schedule. There's a primary care component and a specialty component. And I referenced where those are found in the budget. And again, we just ask for your support to keep that in as it came out of the House. It's a very important priority for our members. So thank you.
Thank you.
Perfect.
That's it. I mean, you're on the timeline here,
So
You came in 2 minutes ahead.
All right, Mary Kate Woolman, terrific. We have time left over. We can have a discussion. Thank you for being here.
Thank you. For the record, my name is Mary Kate Woolman. I am the Director for Vermont Public Policy at Bi-State Primary Care Association. I want to thank the members and Chair Lyons for having us here today. Bi-State represents Vermont's federally qualified health centers, Planned Parenthood of Northern New England, and the Vermont Free and Referral Clinics. Our free and referral clinics request was included in the House budget, so I'm going to jump right to our FQHCs. The House passed budget included a 4% Medicaid rate increase for FQHCs, which comes out to about $742,000 in state funds. We appreciate the House Committee's consideration of our budget request, but we're here today with our full request, which is $6.9 million in state funds. Let me put this budget request in context. This amount reflects the cost of providing comprehensive services to Medicaid enrollees, and it's also reflective of how the federal law says FQHCs need to be paid. On that point, FQHCs are paid differently from other primary care. You heard Jessa just talk about the primary care rate increase that was included in the House budget. That doesn't go to our members. We get paid a different way. Congress established in law that Medicaid should pay each health center a per visit rate based on each individual cost for providing Medicaid covered services. That's not the current practice in Vermont. 8 of our health centers receive the exact same per visit rate, and the other 3 have different rates based on location, not cost. This gap between our members' cost to provide Medicaid services and what the state reimburses is effectively our budget request, 6.9 million in state funds. So why are we here now asking this? This isn't a new problem. But first, the offsetting funding sources our members have relied on to balance their budgets are drying up. We can no longer afford to subsidize the cost of care for Medicaid enrollees. Second, multiple FQHCs are currently operating at a loss and are for the first time ever considering reducing the offered services. And third, while we have been working with DVHA on our rate structure for over a year, no significant progress has been made. Therefore, on this last point, we have also asked that the legislature pair these funds with a requirement that Vermont FQHCs and the Department of Vermont Health Access move forward as soon as possible to update the FQHC payment methodology. And that's actually H206 on the wall, but we can talk about that at a later time. I know I did a 101 with this group, but I just want to remind everyone that FQHCs are a key part of the healthcare system. We serve a third of Vermonters and Medicaid enrollees, essential partners in the communities they serve, with over half of their board members required to be community members receiving care at that FQHC. They are safety net providers that provide care regardless of a person's ability to pay. And they provide services that go beyond what is typically thought of as primary care. So mental health, transportation, OBG, nutritional access, substance use disorder treatment, and health education. We recognize the challenge of balancing multiple budget requests and appreciates the committee's consideration of our requests. It's really grounded in the reality our health centers are facing today. They're extraordinarily fragile, and this funding is critical. So I just want to thank you once again for the opportunity to speak for them.
Thank you. Good. Julie Kessler here.
May I screen share, Alex?
Yes, of course. You should be all set.
Thank you very much for having me today. My name is Julie Tester. I work at Vermont Care Partners. And I'd like to give you the 101 and our budget request all in 5 minutes, no problem. Vermont Care Partners works with 16 designated specialized service agencies. Our services are all person-centered and family-centered. We want everyone to live in healthy and safe communities, and we address the social contributors of health. Hopefully you know who your local agencies are. In Chittenden County, there's actually 3. We like to highlight that our services are accountable and transparent. We report 240 measures to state government, and people are generally very happy with the quality of our services. 90% say it makes a difference. The services are integrated, they're cost effective, they're inclusive, and our staff are amazing, really skilled, hardworking folks. Our mandated populations include adults with severe mental illness, children with severe emotional disturbance, people with developmental disabilities. We also are preferred providers for substance use services. Everyone in Vermont can access our outpatient services. We provide 24/7 crisis supports. We do community outreach and education, and we provide a great deal of support to our schools. This slide is just about how we replace the institutions. I'll skip it. This is from our website. Please take a look if you would like to know more about our work. Part of what we do is provide services in the community so people aren't going to the emergency department and inpatient. And these 2 charts just show for children and adults how many services we're providing in the community versus the inpatient, the emergency department. We're also working really hard to develop alternatives to emergency departments. So the big picture is last year we served 30,000 Vermonters. We did 6 million service hours. 2 years ago, I would have said 36,000 Vermonters, but we've had a workforce shortage and we've not been able to meet everyone's needs, even though needs have gone up. And unlike other health providers and nursing homes and state employees, there's no COLAs that are normal. We did get an 8% rate increase last year, and that was very helpful. But this year, the governor's budget was level funded. The House gave us 4%. This is a chart that shows over the years the difference between our cost of living increases and inflation. So you can see that even though last year the 8% kind of kept us even, there's still this huge gap that we haven't caught up on. And so we're still really struggling in spite of the 8%. This is a Green Mountain Care Board slide that shows different health providers' funding mixes. Our funding is almost entirely Medicaid and state funding, so there's no cost shift possible for us. What happens when our system fails? More people end up in the criminal justice system, inpatient emergency departments. Some of the students get sent out of state to environments there. It's really very critical. Last year, over a third of our staff left. This year in BS, we have on average a 20% staff vacancy rate. So you put that together, 50% of our staff are either brand new and learning their jobs, or they don't exist. So that really affects access and quality of care. Even though I think we're doing a good job on quality, we're struggling. Our vacancies, as they've gone up, that's the chart on your left. On the right shows our crisis and residential beds. When our vacancies go up, it affects those beds and services the most because we're asking people to work nights, weekends, holidays with very difficult folks in very difficult situations. So you can imagine we're not able to provide the crisis supports and residential supports. And so, you know what happens to those folks. I'll skip that next slide. Our request is a 10% Medicaid rate increase. We want to make progress. Oh, I think I missed a slide in here. Oh, well, because I wanted to point out the statute that statutory language this committee passed that said the Secretary of Human Services must consider inflationary factors, including labor market dynamics, when setting a cost adjustment factor for designated specialized service agencies. This current inflation rate is 6.2%. So the House gave us 4%. That means we're still going backwards. We need to go forward. We need to fill these positions. We need to be fully staffed and have experienced staff that have time to develop their skills. And we want to be able to meet the people who are waiting for services on wait lists. Again, when you're waiting for outpatient and you don't get it, you're at risk of your condition getting worse and needing the hospital. I'm at time. Okay, I'm just run through these. We'd also like to address mental health rate equity, working with the Secretary and Department of Mental Health on that and doing some cost analysis and to work towards adjusting that. A small amount of money would be very helpful. The elder care program has been level funded for like 20 years. We have over 50 elders waiting. We're losing $500,000 each year because we just feel like we have to do more, but we can't, like other programs, continue to subsidize programs. There's nowhere to subsidize them from. And we're also asking for $3 million in tuition assistance and loan repayment, which helps with workforce development as well as recruitment and retention. The House put in 3. Thank you. I hope you have some
Thank
time to
you.
look at
That
my
slide
other
is very
materials.
important, and your comments around inflation are going to are ubiquitous. So, yeah, thank you.
Thank
Did you
you.
say 3 million in tuition assistance?
That's what the House gave us. We're asking for 6.
got you.
Yeah.
Okay.
Thanks.
And as I said before, we will be looking at what is included in the budget in our area going forward. Okay, so Susan Aronoff, you are here. You're on the screen. Good morning. Go right ahead.
Good morning, Madam Chair. Good morning, committee members. Thank you for having us in this morning, in person or virtually. My name is Susan Aronoff. I am the Senior Planner and Policy Analyst for the Vermont Developmental Disabilities Council. And I've submitted written testimony that will give you a little bit of background on the council, but I always need to start my public comments with this clarification that while I am a state employee and I work in the Agency of Human Services, the Agency of Human Services has a personnel policy that prohibits state employees from making public statements that are, disagree with some official position of the governor or the agency like that. So I'm speaking here on behalf of the council. The council is federally funded and federally created. All 50 states have one under federal law and under a memorandum of understanding that we have with the Agency of Human Services. I am free to testify about what the council wants, regardless of what's in the governor's budget recommendation. So our council is made up of 60% or more of people with disabilities and their family members. We also have some state employees on our council and a representative of a service provider. Our council has a policy committee, and the policy committee every year comes up with a platform. There are 3 items on the platform this year that impact the budget. And I'm only going to address 2 of those 3 today, because the 3rd one is housing, and we understand there's going to be another time to talk about that. So the first item on the platform, and I sent you the platform, is oversight and quality. Fund oversight now. Vermont's home and community-based service system is in crisis. Robust state oversight must be funded. There have to be checks and balances in the system that's delivering community-based services. Last year, the House passed a bill requiring increased oversight of developmental services. The Senate Appropriations Committee removed the enhanced oversight requirements because those positions weren't funded. And so that's why I'm here today, even though the House budget that's been passed does include 9 new oversight positions, $500,000 of general fund, $1 million gross. I want to just really emphasize the need for those positions. It was a really good idea last year. It's an even better idea this year. You'll see in my written testimony, I go through chronologically some situations that have kind of made it into the press regarding allegations of abuse and neglect in our shared living system. There was at least 1 death. People are understandably concerned. In January, the Digger did a fantastic article that just laid bare the system in crisis. And I think the best quote in the entire article is from my boss, Kirsten Murphy, the executive director of the DD Council, who said, "There's just so many different problems, and it's not anyone's fault or bad actors." She didn't say this, I'm ad-libbing. I cannot stress that enough. It's just that she went on to say, it's just that it's been an under-resourced system for a very long time, and it doesn't have the quality oversight mechanisms it should. It doesn't have enough checks and balances. So the second item with oversight, and I am going to channel Beth Seitler here. Beth is the executive director of Champlain Community Services. She's also one of our council members. CCS is a specialized services agency, and our second budget item follows up on Julie Tesler's request for a wage increase of at least 10%. In addition, our platform calls for annualized rate reviews and rate increases so that we don't have to have this conversation every year. But I cannot tell you the impact the workforce crisis is having on people with disabilities and their family members. I really encourage you to have Beth Seitler in, because the thing about oversight, and she says this so clearly, is that unless you increase the wages, then increasing oversight is just going to point out all the problems that we all already know that we have. At our recent council meeting, Ms. Seitler linked the need for oversight with the need for wage increases. Quality services require a professional workforce, and a professional workforce requires professional wages. Our agencies are competing with McDonald's for entry-level workers and for the state and the hospital system for workers with experience. This has got to stop. Vermonters with disabilities need quality services and supports available to them in the community, in all of our communities, so that they and their families can live with dignity and independence and safety and services in their home and communities. The House budget includes the 9 positions. We ask for you to support those positions and support the wage increase. The wages must match the true cost of providing services.
Susan.
I'm done.
Yes, you actually, we don't want you to be overdone, so. we wanna
Okay.
make
I'm so
Well-
sorry. I'm reading and I have no awareness of the room anymore. I'm terribly sorry.
We have the message and we also have your written testimony, which is very clear. So
Okay.
Thank you.
Thank
Yeah,
you,
no.
and thank you for your time. And really, I can't thank you and your committee members and Senator Hardy for her service last year on the conference committee enough. Your championship of people with developmental disabilities has really been noticed this year and appreciated. So thank you.
Thank you. And we do have Ellen Riley here on the Developmental Disabilities Housing Initiative. And FYI, this is a welcome testimony for us. And we will be also focusing on some housing issues next week.
I'm not
With
going to speak
economic.
to housing, I'm going to speak to
Okay.
the crisis I'm in right now.
Thank you.
So thank you very much for allowing me to speak. My name is Ellen Riley. I live in Moortown up on the mountainside. I'm 68 years old and recently retired from the University of Vermont Medical Center, working in clinical and anatomic pathology for 45 years. At this point in my life, when I should be enjoying retirement, I am providing for and managing the life of my 25-year-old son with Down syndrome, who lives full-time at home with my husband and me. Since the day he was born, I have worried about what would happen to him when he became an adult. What I always have to manage is life and care for him. What will happen if I get sick, if I lose my mental status or die? I've worked tirelessly to have him be provided with a full life, active, have as much as possible the opportunities as his neurotypical peers. However, I had always had to rely on the support that the schools and the agency programs have provided, and I'm very thankful for that. He cannot navigate his life on his own and independently. Some of you may have raised children without disabilities and raised them to be independent adults. My son will never have that life. I need the support of direct services to transport him to work and to community activities, to support him at work and in his activities, to engage with him and create a robust and full life to keep him safe, to mentor him, to continue to help him develop skills he needs to navigate social situations and life skills. Since June of 2019, when he left high school and that security, in the course of 3.5 years, he has had 5 different direct support personnel. Some have lasted a few months, some have lasted a year. One in particular has to split his time between my son and another client who's in desperate need of support. And now just a week ago, I was informed the woman that has been supporting my son for just 5 months is leaving to take a better position with higher pay and benefits. The people who have left to go to jobs with a higher pay and benefits. And with each one of these changes, my son has had an experience of a disrupted routine, anxiety and uncertainty, and the challenge of learning to interact and connect with this new person. The cumulative stress has resulted in episodes of anger and depression, and they can be spurred by just the slightest deviation in his daily routine. He normally is an incredibly happy and loving person. If any of you have ever known someone with Down syndrome, they have the love gene. He can be stubborn, but he's always been able to navigate changes until this. So the person who's leaving in 2 weeks had finally been able to stabilize him, build up his confidence, and now she's leaving. And there is no one to hire. There's no one in place, no one trained, and this is happening in 2 weeks. So his jobs are jeopardized, his activities are jeopardized, and I'm really worried that he will crash. He's just one of hundreds of individuals with developmental disabilities who need support. And they may have support, but it's inconsistent, constantly turning over. They have partial support, or they have no support. I belong to the Developmental Disabilities Housing Initiative, and through that, I have met so many parents my age and older in their 70s and 80s who are still caring for their adult children in their home and supporting them because there is no personnel to service them. There is an immediate staffing crisis for developmental services that directly impact our adult children, the children of your neighbors in your churches and communities. Their families are suffering because of the staffing shortage, and families, me, are left carrying the load. I'm not going to go through the next part of my testimony because you've been handed out the fact sheet about Vermont Care Partners, the statewide agency, 16 agencies. But I think if you just hone in on that, the one fact there are over 1,000 vacancies. In January of this year, of the 6,280 staffing positions, there are 1,000 vacancies. I think the other is the turnover, the lack of benefits and proper wages. You can't retain people. Who's going to work for that? It's a hard job to be all day long with somebody with a developmental disability. And they all vary. My son, is pretty high functioning, but you take somebody who's physically challenged and developmentally challenged, you need to train and have qualified individuals caring for those adult children. As has been pointed out, the Developmental Disability Housing Initiative requested a 10% Medicaid increase so that developmental services could reduce the staffing crisis, along with asking for an annualized rate review for home and community-based services. That request was minimally funded in the House budget. So you can read my testimony, but I respectfully ask you to do what is right to ensure that my son and Vermonters with developmental disabilities are supported, are able to live inclusive and fulfilling lives like your own children, like we all do, and that they have qualified, trained, appropriately paid staff so that they can be retained. Please do the right thing. Please, please push for this 10% Medicaid rate increase. Thank you for listening to my personal real and emergent need.
Thank you. Well done. Thank you very much. And we do wish you well with next steps. Not easy. I very much understand. All right.
Apologies, but I have to go
Yes,
to the
you're
front
fine,
desk.
Senator. Thank you. So we're going to move on to Ruby Baker. There you are.
Here I am.
I need to ask you a question later, but this is.
Okay. I'm available. For the record, I am Ruby Baker. I am the Executive Director of the Community of Vermont Elders and also the facilitator of the Long-Term Care Crisis Coalition. The Long-Term Care Crisis Coalition represents more than 200 providers across Vermont, providers of assisted living, adult day services, area agencies on aging, home health agencies, residential care homes, nursing homes, and other organizations who care for Vermonters who need long-term care services. We came together about 2 years ago, recognizing that the system was crumbling beneath us and that we needed to unite and really figure out collectively what and how to get what we needed. Long-term care services, in case you don't know, are the supports for family members, friends, and neighbors who are unable to perform basic activities of daily living. So that's dressing, bathing, meal preparation, homemaker services, and they can be provided at home, they can be provided in the community, in assisted living, or in nursing homes. I want to thank this committee for your support of these programs in last year's budget process. And part of that support required DEVA to conduct rate studies to determine what the actual cost of delivering the services is. And we have had rates that were not based on actual costs for a really long time, and increases that were not based on actual increases in costs. So when those studies came back, I'm sure you saw them, they came through your committee, they showed that some of our services needed as much as an 80% increase to meet the cost of delivering services, which is appalling and horrifying and a really big number. The House worked really hard on the budget, and we were very pleased with what they were able to send over to you, including pretty significant increases in investments in the long-term care service sector. And so the coalition and COVE, we're strongly in support of the House budget as it came over to you. There is a portion of long-term care services that was inadequately funded, and so we would ask you to increase the adult day services rate to $25 an hour. Then you can go to the Burlington Bagel Factory is hiring at $25 an hour. So providing these adult day services, it's vital, it's an essential part of our community. We absolutely have to get them up to this rate. Otherwise, we know that we will see closures. We're really afraid of the impact that this will have on our broader communities if we start losing more programs. And it really just doesn't make any sense to make them come back and ask for emergency funds every year. Let's just fund them the amount of money they need. Yeah, that's my ask. Keep most of the long-term care and increase the adult day services.
Thank you.
For me?
Yeah, thank you. And I'm sure that, well, we'll certainly take this under consideration. We know the pressures.
Thank you.
Thanks so much. Okay. So Mary Hayden is here for the AAAs.
Hi.
Good morning.
Good morning.
See you.
Good to see you, thank you.
Go ahead.
Thank you, Madam Chair. I'm Mary Hayden, the Executive Director of the Vermont Association of Area Agencies on Aging. And thank you for inviting me today to testify on our nutrition program, operations, responsibilities, and most importantly, funding. We are an association of 5 area agencies known as the AAAs, you may have heard, located throughout Vermont. Our mission is to provide advocacy, leadership, and a voice for our aging network. Our services include Meals on Wheels and community meals, long-term care coordination, commonly referred to as case management, caregiver programs, Medicare and health insurance counseling and education, wellness activities and programs, information and referrals for legal, mental health services, and benefits such as housing, fuel, and 3 Squares Vermont. The Area Agencies on Aging, in partnership with the Vermont Association of Senior Centers and Meal Providers, is requesting $3 million in fiscal year 2024 to meet the demands on the older Vermonters nutrition program. While we appreciate the $1 million the House added to the base budget, it is insufficient to meet the needs of this program. The $1 million in one-time funding for the Vermont Food Bank is also not enough. So the AAAs also support the Vermont Food Bank request to increase its appropriation to $3 million. The Federal Older Americans Act funding for nutrition, which is home delivered and congregate meals, passes from the Federal Administration for Community Living through DAIL to the Area Agencies on Aging under a clear funding formula. The AAAs contract with community meal providers as well as commercial vendors to prepare and deliver meals. With the growing number of older Vermonters, funding is no longer meeting the need for home delivered and congregate meals. Contracts with community meal providers provide a per meal reimbursement rate, but the average reimbursement rate is only $5.44 per meal, $5.44 per meal. And the lowest end of that range is only $3.80, with the high end of the range at only $6.96. While the average cost of meals in 2021 was $11.75, which is almost $12 per meal. So there's just a mounting funding gap, which we expect to be even greater when we received the 2022 data. We served 1.1 million meals in 2021 at an average cost of $11.75. The total cost for that is $13,700,000, but the total funding is only approximately $1 million. So there is a funding gap already accruing at $4.2 million. Vermont must increase its investment in nutrition for older Vermonters to create a sustainable and cost-effective plan for the future. We are also suggesting a study to look at sustainability of the program. Our proposal would be for $3 million appropriated to Dale for the purpose of providing additional funding for congregate and home delivered meals in the Older Vermonters Nutrition Program. And on or before January 15, 2024, that Dale, in consultation with the meal providers and senior centers, as well as other meal providers, stakeholders, and the area agencies on aging, submit a report to the House Committee on Human Services and the Senate Committee on Health and Welfare, evaluating the Older Vermonters Nutrition Program, and to make recommendations for short and long-term program sustainability. Thank you for the opportunity to speak to you today about the Meals on Wheels program funding. I'm happy to answer any questions.
Thank you, and thank you for your work, all of you. Okay, so we'll move on to Linda Whitlock. And Linda,
Yes, I'm on
there
Zoom.
you are. I knew you were up there somewhere. Okay.
Good morning. My name is Linda Witchlack, and I'm the Executive Director of Bennington Project Independence and the current President of the Vermont Association of Adult Day Services. First of all, I'd like to thank you all for supporting the money in the FY23 budget adjustment process for Adult Day Services. This money will help to ensure that we can continue to serve Vermonters through this current fiscal year. In the FY24 budget discussions, the House included a 15% increase for our Medicaid reimbursement rate, which would bring it up to $21.33 an hour. So this amounts to a little over $1 million gross. While we were truly grateful for this increase, we know that the level of additional funding that we needed this fiscal year and last due to our low reimbursement rate and the reduced census due to COVID will not effectively stabilize adult day programs. Our reimbursement rate needs to be $25 an hour. It's our understanding that this would cost approximately $2.4 million gross. We strongly disagree with the recent rate study, both the process and the results. It was based on a lack of understanding as to the services our programs provide. The consultant tried to put our programs into a template or model that just didn't align with the realities of what we offer in Vermont and what our needs truly are. We tried repeatedly to remediate these misunderstandings, but to no avail. This year, as everyone knows, has brought hugely inflated operational expenses, food, heating, maintenance supplies, and a limited workforce that demands much higher compensation and benefits, as you've heard from other testimony. The only way we were able to make ends meet prior to the pandemic was because we were able to pay low wages and the operating costs were not as inflated. With the reimbursement rate of $21.33, adult day programs will still not be able to hire enough qualified people in order to increase our census to the levels the state and the association would like to see. The lower census means that not everybody who wants to attend will be able to. There are over 70 people on the official waiting list, but this number is in actuality much higher. The lower census also means that we cannot bring in enough revenue to compensate for the low reimbursement rate. It's a catch-22 situation for us. Many of these people have loved ones that they're caring for, who are caring for them and need respite that adult day services provide in order for them to be able to get back into the workforce and to be able to continue to care for their loved one and to have some semblance of a normal life. In reality, we all know that there are just not enough caregivers to meet the staffing needs. Again, as you've heard from other testimony, agencies like home health, nursing homes, the disability community, or provide the in-home support that our growing population, older population, would like or need. Also, we are, as human beings, are inherently social animals. The loneliness and isolation increases the risk of premature death by 14%. And has had a profound mental and physical effect, as we saw during the height of the pandemic. Adult day services are uniquely designed to assist with both of those areas. Adult day programs have been an incredible bargain for the state. We provide some of the healthcare services and chronic care management that helps keep people out of emergency rooms, hospitals, and nursing homes. We provide nutritious meals and personal care services. We provide social and therapeutic activities that keep people engaged, happy, and independent for as long as possible. And we've been able to make that work with a lower reimbursement rate, but we cannot do that anymore in this current economic climate. So we're asking for your help and support to and request a $25 an hour Medicaid rate for adult day services. And I thank you for this opportunity to speak with you this morning.
Thank you. It's very clear, and we're starting to hear a theme from different folks, and this is really helpful for us, honestly. So Molly Dugan is here. Thanks for being here, Molly. Okay.
I'm gonna share my screen real quick,
Okay.
as long as Alex lets me.
Yes, you are good now.
Wonderful. Beginning. Okay, here we go. Okay, good morning. For the record, my name is Molly Dugan, and I'm Director of Policy and Strategic Initiatives at Cathedral Square. I've been with Cathedral Square for 15 years. My previous position, I was the founding director of the statewide SASH program, Support and Services at Home. And I'm here today, been in my current position for about a year and a half. I'm here today to ask your committee to support a budget request to continue the SASH for All pilot that launched at 2 SASH housing organizations, Brattleboro Housing Partnership and Wyndham Windsor Housing Trust, in the Brattleboro area just this past September. We would also like you to consider a modest expansion of this pilot to serve more Vermonters in need of this homelessness prevention and population health model. So what is SASH for All? It is modeled on the traditional SASH model operating across the state since 2011, and that has been independently evaluated and shown to increase the health and well-being of participants and reduce the growth of healthcare spending, both Medicare and Medicaid. SASH for All shifts the focus population of the SASH interventions to younger adults and to families with children. This model provides 3 housing-based staff, and you'll see this on this visual, it's kind of a visual, but I'm going to say. So there's the model provides 3 housing-based staff, a full-time support coordinator, a half-time wellness nurse, and a half-time peer support specialist who's hired through the local mental health designated agency. And what they do is they partner with participants and their families to set goals, develop action plans, and for both individuals and the entire population of the affordable housing community. So what are the expected outcomes of the SASH for All pilot? We expect both short-term positive outcomes as well as long-term benefits. These include fewer move-outs and evictions, reduced barriers to preventative health, increased engagement around mental health services, decreased emergency room visits, and low barrier preventative screenings for a whole host of health and well-being areas. So I know this slide is really busy, but those are the main things. So how's the pilot going? Since its launch on September 1st, staff is on board at both sites, Wyndham Windsor Housing Trust and Brattleboro Housing Partnerships. They've completed the 4-week onboarding training on the SASH core elements. They've also completed the evidence-based strengthening families framework training. Memorandums of understanding with partner agencies are in place. The partners in the SASH for All model include the designated agency, HCRS, the Brattleboro Memorial Hospital, Winston Prouty, and Turning Point. Staff are building relationships, enrolling and assessing participants, and working with individuals in their communities to identify challenges and find solutions. So we have collected data to date on the pilot. It really got started very quickly. We got staff on board and went for it. All of the data for this pilot is entered into the same data management system that we use for the traditional SASH model, which is statewide, which is why we can collect these. So in a nutshell, we're right now serving actually 80 participants. Average age is 40, so a much younger population than traditional. You can see the statistics on, we have 74% are male, 23% are female, and 3% are identifying as non-binary, which is actually pretty much flipped from our traditional SASH model, where most of our participants are women. It's almost like exactly opposite, which is interesting. We're finding out, asking questions around food insecurity and other things. You'll see that, financial insecurity as well, about 76% of our participants are identifying as food insecure. We also find that over 70% are struggling to meet basic living expenses. We also collect health information, of course, and so this gives you some of what we're finding already, what the top chronic conditions are. We also know that the average blood pressures of these folks is they're in what would be considered stage 1 hypertension. So we're finding these things earlier with folks, and the idea is that we're going to prevent it. So we're seeing positive outcomes already. For example, to date, staff have helped secure about $10,000 in funding to keep 9 families housed that had gotten behind on their rent. That's just an example. Okay,
You've hit the,
okay, so here, this is my last slide. So this is our request. So we're looking for $450,000, which would provide just the year 2 funding for the current pilots. If we could get a modest expansion, this kind of breaks out other options as well. And it's based on a per panel expense. So, you know, we can modify it based on that, but at a minimum, we're looking to continue the 2 pilots because the congressionally directed spending that we got from Senator Sanders will finish up at the end of August, this August. It was funded for 1 year. So thank you very much.
thank you. And we've got all of this data on our.
You have everything, yeah,
All right, thank you.
yeah.
Okay, Amy Rose is here. Thanks for being here.
Thank you. For the record, my name is Amy Rose. I'm a policy associate with Voices for Vermont Children. I want to start by offering Chair Lyons and this committee my sincere gratitude for your historic leadership on this issue. I realize that your committee has discussed the federal poverty guidelines. ECF's basic needs budget is similar to the federal poverty threshold that is used to determine eligibility for many programs. Similar, and that is unrealistically low. With the rateable reduction applied, a family of 4's maximum basic needs stipend is currently less than $1,000 a month. That's less than $12,000 annually. The maximum housing stipend is currently less than $500 a month, less than $6,000 annually. Why does this matter? At a time when the high end of our continuum of care is in crisis, it is important to zoom out. If we fail to shift towards stability, we can predict that about half of the children who are on Reach Up today will receive benefits as adult participants. We know that persistent poverty is harmful to kids, and parenting in poverty creates a level of stress that is untenable. Adults often call child protection services when barriers to safe housing, adequate food, transportation, and healthcare, and more show up in children's behaviors. While kids are not taken into state care due to poverty alone, we know that the symptoms of poverty create understandable concern, and therefore, kids who are living in poverty are much more likely to come into state custody. We hear about kids being restrained in foster homes, switching placements at alarming rates, and quickly ending up without placement options. Voices encourages this committee to prioritize funding Reach Up in the budget, as well as the other difficult conversations that you will be having this session. In addition, we've heard from mothers who are in unsafe setting at home, but without a financial safety net, they're stuck deciding which terrible option is best for their kids. If they leave and don't have the capacity to meet basic needs, they fear the court will grant custody to the unsafe parent. They also worry about the unknown dangers of emergency housing options. Having a safety net that works will give people the space to make the decisions that they need to that are in their child's best interest. Why does it matter for the community and other provider networks? You have likely heard that many of our systems are stretched thin. When we don't adequately fund Reach Up, the demand for the other services rise. It creates a burden on the families and it transfers the state's responsibility to under-resourced community organizations. Continuing to underfund Reach Up harms children. Voices appreciates the spot the legislature is in when it receives a budget that includes significant budget gaps. We look forward to a day when that is not the case. In the meantime, it is important to acknowledge that every dollar invested in children, youth, and family matters. As a committee, you will have many opportunities in front of you. The Reach Up Coalition would like to respectfully make a few budget recommendations for the fiscal year 24 budget. 1, accept House Human Services language to create a structural change within the fiscal year 24 budget. It is important to use current estimates when creating basic needs type estimates for children, youth, and families. We currently use a 2019 basic needs budget to determine our Reach Up grant, and I've included the language in the memo. Add $3 million to the fiscal year 24 budget to bring the basic needs budget to 2023 levels. Create similar language for the Reach Up housing allowance. We last updated the housing allowance in 2001. We know housing is a complex and difficult, but these structural changes are critical to the success of this program. I have a couple comments on H94, but I know that you're very busy, so I'll hold off on those for today. But I would like to conclude by just acknowledging our growing and thriving Reach Up Coalition, and once again, offer my gratitude for the work that you are doing to create more equitable safety net for Vermont.
Thank you. Good timing. Great. Okay, Matt Levin.
Good morning. So I'm Matt Levin. I'm the Executive Director of the Vermont Early Childhood Advocacy Alliance. First, I'd like to comment very briefly on issues related to Children's Integrated Services, or CIS, on behalf of the Alliance's CIS Working Group. The House FY24 budget does include an increase of $950,830 to CIS base funding to support the projected caseload increase, and $768,180 in one-time funding to allow 3 more regional CIS fiscal agents to adopt the Salesforce-based data system that has been developed by the Family Center of Washington County. We support both proposals and hope they will be included in the Senate budget as well. And I've included more information about the data system proposal in the materials that's on the committee. On the topic of the diaper bank, I am testifying on behalf of the Junior League of Champlain Valley, the organization that has been running the diaper bank since 2018. I'm following up on a report on the diaper bank program sustainability that was done last summer under the auspices of the Vermont Food Bank and at the encouragement of this committee. You've gotten copies of that report directly from the Junior League. It's under my name in your committee website, but it's from the Junior League. The report makes it clear that the diaper bank is a critical service that supports the health and well-being of thousands of Vermont families and young children. As many as 1/3 of all families with young children in Vermont struggle with diaper need. That in 2022, the diaper bank distributed 879,619 diapers to 57 partner agencies. The program is operating successfully around the state, and while it does not address the full need the community-based agency partners report, the program has a very large positive impact for their clients. The current program's volunteer-based operational model is working well and is ready to be transitioned to a more permanent structure with dedicated professional staff. There is no practical way to include diapers and other support programs such as WIC or 3 Squares Vermont. And again, the report says that the most efficient, effective way to support this critical service is through base state funding of $380,000 to cover the costs of bulk discount diaper purchases, as well as staff and logistical costs. The Parent Child Center Network has offered to serve as the fiscal agent for the program should funding be secured to allow for staff to be hired. So again, that's all in the report. So unfortunately, the House did not include the $380,000 in base funding that we are requesting in their FY24 budget, and we are asking the Senate to include that funding. For the past 5 years, this program has been entirely volunteer run. That model is no longer feasible, as the Junior League does not have the internal resources to continue this level of support, both in terms of staffing distributions and securing philanthropic or grant funding past this summer. Without the state funding requested, operations will shut down this summer of the statewide program. And when the funding that has been secured to support diaper purchases is all spent. So we hope that you will consider including the requested funding in the Senate budget. Thank you for your consideration.
Thank you.
I'd be happy to answer any questions after the session today.
Good.
Thank you.
Okay. Chad Butt, welcome.
Thank you. Hello, I'm Chad Butt, Executive Director of Mentor Vermont. Thank you for Senator Lyons and committee members for having me here. Youth mentoring is a proven prevention tool with proven mental health benefits. Youth with mentors are more likely to attend school, participate in sports and community activities, and are less likely to use harmful substances and make suicide plans. Every Vermont youth deserves access to a caring, trusted adult mentor. Despite critical youth mental health needs and proven social and emotional benefits of mentoring, the state's investment in mentoring has not increased since 2007. And in fact, it decreased in 2011 and has continued at that level since and not been raised. During COVID, since COVID began, we've seen a 35% drop in youth mentoring in the state not because of mentoring programs have not done a great job supporting mentors, but just changes of life and really the difficulty of recruiting mentors during a pandemic. Mentoring relationships provide children and adolescents with individualized one-on-one attention and support, and as a proven tool to prevent substance use and violence prevention and suicide prevention. These connections are critical tools that help ensure young Vermonters have the supportive mentoring relationships they need to grow and prosper. Mentoring helps youth and provides benefits to the community members who volunteer as mentors, as well as the youth, and provides a nice connection for everybody involved in supporting the community as a whole as well. We know that when youth feel like they matter to their community, they thrive. And we see that mentoring provides that connection for youth and their community to individual people and their community as a whole. We also know that there's a critical need around the state. There are areas of the state that have very little mentoring, and there's also areas of the state even that have numerous mentoring programs that are unable to meet the need that their community has expressed. They have wait lists throughout the state, and we really need increased funding to ensure that we have the ability to have more staff time so they can recruit and train and support these mentors so they have successful relationships with their youth. Our original request to the House was an increase of $1.5 million to support, and with the support of the House Human Services, House Education and Appropriations Committee, we were able to get a budget increase of $480,000 in our DCF Family Services Division grant in the House version of FY24 budget, bringing the total support of that grant from Mentor Vermont to grant out the programs to $650,000. We are very appreciative of this increase, but it only represents 13% of the funding that is going to be needed to really support youth through mentoring in the state. We're here today because we've heard at the Senate Appropriations Committee discuss whether mentoring and other proven prevention programs should be funded through these types of grants or should be funded through prevention funds using from the 30% excise cannabis tax. We know that mentoring is a prevention and that it supports youth. We urge the Senate to find a sustainable way to increase funding to support evidence-based mentoring programs around the state that encourage resilient youth and communities. Thank you.
Thank you.
May I ask a really quick question?
Yeah.
I live in Burlington and the King Street Youth Center has a mentor program. Do you guys work together or is that their own?
Yes, we fund them. Actually, on the drive down here, I talked to Gabe Tupo-Strauss about trying to figure out how to provide more mental health services, and we're trying to figure out if we can actually hire a clinician to be on call to support mentoring because she's running into a lot of those issues. But we do work with King Street. We fund them.
Gotcha. Thank
Yes.
you.
Can I ask a question?
Yeah.
Clarification.
Please.
So the House increased it by 490,
480.
480.
Yes, to 650 total through the DCF
And
grant.
what are you asking the committee? You asking to support the House position or you're asking for more?
We would love more, but we want to make sure that it's funded at that level at least, but also that we want to make sure it's funded.
So your total request was 1.5 million, and that's what you're asking.
We would love to see an increase from that 650 level, but I think the main concern for us is really where does that fall? Is it through a grant through DCF? Is it through the excise tax? And from listening to the Senate Appropriations, it seems trying to figure out where exactly it would go. But we hope that we can find a sustainable source of funding for it.
Thank you.
Thank you very much.
Marcy Hambrick is here.
Hello. I
There
am
you-
here. I'm going
All
to need
right.
to share my screen.
Sure.
So I'm Dr. Marcy Hambrick, the Director of Child Sexual Abuse Prevention at Prevent Child Abuse Vermont. Our Executive Director, Linda Johnson, would have been here herself, but she's dealing with a very difficult case of COVID at the moment. Thank you, Chair Lyons and committee members for inviting me to speak. PCAVT is an organization that has been in existence for 45 years. It's a nonprofit whose mission is to promote and support healthy relationships within families, schools, and communities to eliminate child abuse. All of our work is based in science. Currently, PCAVT serves about 8,000 individuals annually. Prior to decreases in funding, we worked with 14,000 children, youth, and adults annually. This graphic shows our funding history, and you can see that we have a number of different programs. I'm going to tell you about how we use this funding in our 3 departments. This blue line indicates our family support programs, which serve approximately 400 very high-risk parents, impacting at least 1,300 children each year. The majority of participants are referred by Department of Children and Families. Over 85% of the parents are in recovery for substance misuse, and over 50% have very low incomes of $15,000 or less annually. In all of these 45 years, we've never lost a child or a parent. DCF's grant for this work was basically level funded at around $307,000 annually until 2020, when a 40% reduction was made. This was unrelated to the community need or the quality of these programs. We now offer 60 programs a year, but could easily offer another 60, serving 900 more at-risk parents and 1,500 more children and youth if you improve an increase of $279,513. The orange and yellow lines are the funding for child sexual abuse prevention. With this funding, we provide the Healthy Relationships Project to schools from pre-K to 12th grades, and 85% of Vermont schools have at one time used this program to fulfill their legislative mandated education on the topic. We also train Vermont parents, foster parents, early childhood educators, social workers, and other professionals in how to prevent and report child sexual abuse. These programs work. Rates of substantiated cases have dropped by 67% since the early 1990s, and the rate of youth sexually harming other children is down 77%. However, it still remains the most prevalent form of substantiated abuse in the state of Vermont. As you can see, this funding decreased by $117,000 in 2021. This was unrelated to demand or our history of exceeding grant requirements consistently. When this defunding occurred, our work was more important than ever due to the COVID-19 pandemic and lockdowns, which are thought to have increased risk to children, given that mandated reporters like teachers and early childhood professionals had less eyes on, and those are the folks that make 80% of reports of child abuse in Vermont. PCAVT has 3 full-time staff members who work with our more than 300 schools and nearly 3,000 early childhood educators. Honestly, twice that number of staff is needed. Consequently, we respectfully request an increase of $313,277. The gray line indicates our Safe Environments for Infants and Toddlers program. The funding supports one manager who trains adults and youth to prevent the deadliest form of child abuse for very young children. Since we started this training based on the Mark Diaz model, there has only been 1 infant death resulting from shaking in the past 15 years, which prior to that had been about 3 to 6 instances a year. Also, under this grant, we promote safe sleep with infants. The need for this program is rising. The opioid crisis in Vermont is connected to the deaths of 9 infants last year. We educate in recovery centers, turning point centers, prisons, AA and NA meetings, and high schools. With only 1 trainer for the whole state, even before COVID-19, we could only educate in 1/3 of all the high schools annually. In order to meet the need, we respectfully request an increase of $100,390. Of course, PCAVT will make good use of any increase that we receive, and we will be extremely grateful to legislators. The House Human Services Committee recommended funding half of this amount annually, while the House Appropriations Committee instead recommended a one-time $500,000 disbursement. Although a one-time disbursement could help us expand the work for 1 year, it is not sustainable, and it would lead to shortfalls in the next cycle or the need to lay off staff. For this reason, we ask for an annual increase for all three grants of $693,180 so that we can serve 3,400 more adults and 43,500 more children. And my slides and a letter from PCAVT have been submitted for your review. Thank you so much for hearing my testimony.
Thank you. I did go over a little bit, but you finished perfectly. Thank you. Thank you very much. Amy Schollenberger for the Vermont Food Bank.
Morning. For the record, I'm Amy Schollenberger, and I'm actually here. I'm going to talk about two organizations, the Vermont Food Bank and the Recovery Partners of Vermont. The packet that I submitted actually covers 4 organizations, but 2 of them are funded in the House budget, so I'm following the guidelines that I was given. So thank you so much for having me today. And I want to notice that Carrie Staylor is here from the food bank if you have follow-up questions. So I'm going to start with the Vermont Food Bank. The food bank's request is for $3 million in base funding to address the ongoing and increasing need around food security in Vermont. And what in the House budget, they appropriated $1 million in one-time funding. This is not sufficient. And also what I really want to highlight, there's a lot of detail in the packet, but what I really want to highlight is the request for the $3 million is to purchase food from local producers, to provide that food to community partners, and also to provide grants and support directly to community partners across the state so that they can serve the communities in the ways that are needed. I'm sure all of you have seen and heard about the emergency allotments from the federal government and around SNAP benefits, 3 Squares Vermont benefits. People are worried across the state about how they're going to deal with that. So that's what that request is about. And I just wanted to also note that the Vermont Food Bank is also supporting the request you heard from Mary Hayden about Meals on Wheels. Those 2 things go together, and they will be very important for supporting our older Vermonters as well as all Vermonters of all ages and families. Recovery Partners of Vermont had 2 requests. One is for $1.85 million in base funding for the recovery centers. You might know them as Turning Point centers across the state of Vermont. That was actually included in the House budget. We very much appreciate it, and we ask for your support. The second request was for $1 million base increase for recovery housing. That was included in the House budget, but only as one-time funding. Both of these requests are specifically for staff compensation packages. The people who work in the recovery centers and recovery housing are paid very low wages. As you know, that's getting to be more and more of a problem for a variety of reasons. And the centers and the housing, the residences really want to offer higher wages and also offer benefits packages for their staff. So that's what that money is about, so that when people come to the center and to the residences, they can have consistent quality staff who are there to support them, who are not stressed about their personal livelihood. So all the details are here in the packet. I'm happy to answer a question if I can. The one other thing that the Recovery Partners of Vermont are supporting from the House budget is the House included a one-time allocation of $30,000 for first month rent vouchers for recovery residences. We think that's a great idea, and we ask for your support for that.
Thank you.
Yeah. Just for the food bank folks, it seems as though a few years back, there was a fairly high profile, large donation made to the food bank. Am I right on that?
That's true.
Okay. How is that being used, or like what's happening with that money? I've just been curious about that.
Do you mind if Carrie answers that, or how do you want to do it?
Or we can do
I'm
it
gonna
at a later.
suggest that we hold that question
Okay.
to the end, as long as you folks don't mind us staying around a bit, and because we'll move through, but that's a very good question. It's one I've asked in the past, so
Okay.
we'll
Great.
just go ahead. I think we'll go ahead and say
Sure.
thank you.
Thank
Yeah.
you.
Elizabeth Gilman is here. There you are.
I want to thank you all for allowing me to testify today. My name is Elizabeth Gilman. I'm the Executive Director of the United Ways of Vermont, which includes our cornerstone program, Vermont 211. I'm here today to talk about the funding crisis that Vermont 211 is currently facing. To give a little background, Vermont 211 provides information and referral for health and human services to Vermonters, connecting them to the needed resources in their communities and statewide agencies. We're available 24 hours a day, 7 days a week, every day of the year. We provide this service 24 hours a day, which protects the integrity of the 911 system. We are able to take those non-emergency calls so that those 911 calls can go through as an emergency call. We also provide critical public information during emergencies such as flooding, extreme cold, connection to shelters, and act as a public health inquiry line, which was crucial during the COVID-19 pandemic, where we saw increased call volumes of over 600% for rental assistance and food assistance. In 2022, we provided over 24,000 referrals to Vermonters and received over 49,000 calls for services. 38% of those calls were to support people with connection to housing and shelter. Basic needs is always one of the most critical and largest volume of calls that we receive every year. We have been working with the Agency of Human Services as well, providing that information referral service to them, as well as supporting them with their emergency housing, after hours, general assistance motel program. We administer their program Monday through Friday from 4:30 to 7:45 in the morning, as well as 24 hours a day on weekends and holidays and any day that AHS and ESC are closed. We've been communicating with AHS regarding our new contract, which will start on July 1st, and they've indicated to us that they intend to fund us at pre-pandemic level funding, which is $532,000 a year. In the last 3 years during the pandemic, we did receive a supplemental amount of $232,000, but their intent is to actually decrease our funding and not level fund us. There was a board meeting regarding our budget on March 22nd. A motion was approved by the board if we are level funded at pre-pandemic amounts, Vermont 211 will be forced to close and cease to operate. If we did not, it would force the United Ways of Vermont into bankruptcy. If we were funded with that supplemental amount, we would be able to operate only Monday through Friday from 9 to 3 in the afternoon. This would dramatically impact our state partners and our ability to provide that kind of service. Vermont 211 requests a little over 1.4 million in order to operate. We have made significant changes to try to reduce our operational costs this year, but we are still running at a significant deficit. I did provide some written testimony with the breakdown of our what it would look like if we tried to reduce our operational costs. But the bottom line is we are still in a negative deficit if we are funded pre-pandemic. If we should close on July 1st, the impact it would have is the Agency of Human Services would have to develop their own information referral line, as well as handle all of their emergency housing calls 24 hours a day. We would not be available for Vermont Emergency Management or operate as a public health inquiry line for the Department of Health. We would not be able to continue to support the database for 988, which is the National Suicide Prevention Lifeline here in Vermont. We would no longer be a point of contact for Give Way to Freedom, which is human trafficking hotline. We would no longer be able to support Help Me Grow, which is supporting the most vulnerable Vermonters in Vermont and their children, providing connection to perinatal mood anxiety disorder treatment, as well as child development services in the way that we currently do. And it would negatively impact our relationship and the work that the Child Psychiatry Access Program does in the state, connecting youth and children to mental health services. We have become a backbone for the state of Vermont.
We provide tremendous service to the state of Vermont, and we cannot continue to operate at the level of funding that we are being asked to operate on. And so I ask the Senate to consider the situation that we're currently facing, and I am happy to answer any questions later. I know you're not taking questions now. We have a lot of data. We're very data-based. So I'm happy to provide any of that to you in the future. And I thank you for hearing me today.
What was the human trafficking hotline?
Give Way to Freedom. Edith Kaminsky is the executive director. She's been notified of the situation. I know she's reached out to our Washington delegates as well about this.
And we have that, it's on the bottom of one of the pages of testimony.
I got a call this morning.
Yeah, for our annual appointment. Yeah.
Thank you.
Thank you very much.
No, thank you. This is all sad news.
I know, and I know that you've been listening to testimony all morning, asking for funding. And now here I am asking you for funding, but the level of critical need, we will not operate after July 1st.
Okay, thank you.
Can I ask one quick question? I was looking at the ask, and you're asking for 1.4. Does that include the 532 or is it 1.4 on top of those?
Nope, 1.4 for total.
That's the total.
Yeah, that includes everything.
Thank you. That was a good, I was gonna.
Yeah, it's not an increase, it's a total amount.
Great. Okay, Rachel Seelig is here.
Okay, we're cruising 10 more minutes.
No, 15, but.
Oh, okay.
Yeah, we're good.
I thought it said 11:15.
All right, welcome.
Thank you. For the record, my name is Rachel Seelig. I am both the director of the Disability Law Project of Vermont Legal Aid, as well as our staff attorney for government relations. We also have Kylie Kuiper on remotely, who is the director of our long-term care ombudsman project. You, I think, are mostly now familiar with me. I've been with many of you a few times now. Vermont Legal Aid provides civil legal services to Vermonters across the state in 5 offices and 11 projects. And we've done over the last 4 years, a little more than 10,000 cases across 8 of those projects. And then we have 3 projects that keep their data separately. So I don't have those counts for you. But what you can see is the vast majority of our requests for assistance come in the areas of housing, public benefits, and individual rights. We have a request for an appropriation for legal aid overall of $1.34 million. The House put into H494 $500,000. And this is my first year asking you all for funds for legal aid. And so this has been a learning process. And one of the things I learned from the JFO staff is that we are actually eligible for a match for this. So that $500,000 was not all coming out of general funds. And the 1.34 million did not all come out of general funds. This slide, which you have in your materials, shows kind of my estimate. And what you can see is that if you can fund us at 1.34 million, if that match stays the same, and I haven't heard from AHS whether it would or not, that would be $482,400 out of general funds and federal match for the rest, which I hope to hear soon is what the match rate would actually be. We need this for 3 purposes. First, to maintain our capacity. Second, to meet a significantly increased demand for service that began at the start of the pandemic and has not abated. And third, to address what we see as a significant increase in need around consumer debt and foreclosure as pandemic era benefits disappear or fade away. This chart shows you what we have experienced over the last 5 years. The green line along the bottom is the change in what we've received under the AHS grant from the legislature. You can see that it's a pretty small change. And while we've appreciated the increases that we've seen, you can see the red line shows the call volume change over those years. So call volume has doubled from about 13,000 calls in FY18 to 26,000 calls over the last 2 years. And those calls have become much more complicated. So it's taking us about 3 times as long just to get someone through the door, triage their problems and get them to the right place. And so the $360,000 piece of our request is to be able to better address that. And one of the challenges we're facing is the volume has increased so much that it now takes us, unless someone's in an emergency situation, 7 to 10 days to call people back. It's not what we want. It's not the system that we want in place. We don't feel like it's acceptable. It's the only option we have without additional staffing. The second part of the reason that we are asking for additional funding is because our core, what we call our core programs, our poverty law, elder law, and disability law projects have seen a 29% decrease in staff because of that level of funding over the same period of time. So you can see here, I know this was a little bit harder to see. The poverty law project is on the bottom of the screen. The elder law project is in the center, and my project, the disability law project, we've lost 2.3 FTEs over the last 5 years. We're a really good investment. In 2019, before the pandemic, the Vermont Bar Foundation did an economic benefit study of the investment in legal services and found an $11 return for every dollar that you invest in legal services. And that comes primarily in the forms of income for low-income households, cost savings to the state, and what the economists talk about is the multiplier impact on communities because people have money in their pockets and can therefore spend it. I want to turn quickly to the long-term care ombudsman. Their role is to advocate for folks who are in long-term care facilities or on the Choices for Care program in the community. This is 6,700-ish folks in the community and 6,500 licensed beds across skilled nursing facilities and other facilities.
They do have all of your information.
You have all of my information really quickly. They asked for $450,000. The House gave them $250,000. With $296,591, they could actually get to maintaining capacity and adding one person. $250,000 doesn't quite get them there. So they'd love $450,000, but if we could get at least the $296,591 for them, they could get back to having the volunteer coordinator and training coordinator. Thank you so much. Happy to answer more questions.
Thank you. I'm glad you got that last piece in because Nolan is figuring out our spreadsheet.
And Nolan, I'm happy to give you more details.
We're good.
Anytime.
That's good. Okay, let's move on to Mike Fisher is here on the screen.
If you go back up one, those are the.
All right, Mike.
It's so.
Rachel, can you take your screen down, please?
Oh, yes.
Good morning.
Good morning.
Sorry. So there you are. Good morning. Mike Fisher, healthcare advocate. I just have to start by saying you guys have heard a compelling list of witnesses, and I support every single one of their requests. That's not the right thing for me to say, as I'm going to make another request, but I just feel the need to say that. I wanted to talk to you about two different unrelated issues that I want to put on your table: dental access and the Bridges to Health program, which is a program of the UVM Extension program. I'll start with Bridges. Bridges to Health is a key partner of ours. They provide care. They provide, on the ground support to farm workers. And I learned recently that they are not going to get to continue their funding from the Department of Health. This is they have been getting $700,000 a year to support 6 bilingual community health workers that are on the ground, as I say, and they're a key partner of ours. They're a key partner for this very vulnerable group of Vermonters that need support. And I'll just mention, you helped pass the IHIP program a few years ago that started in July 1st. And without Bridges on the ground helping people get access to that program, we would have far, far fewer people getting the care they're currently getting. So I hope you'll consider, I am not an expert on Bridges funding. I just see them as a key partner and hope that you'll consider extending their funding. I believe their current grant ends January 1st. So $700,000 a year, half of which is funded this year. The other issue I wanted to raise to you is dental. We are on the front line at the Healthcare Advocates Office seeing the crisis play out in Vermont families around access to dental. And the hardest calls we get, people in pain who can't find a dentist and can't get care. So we support very much the governor's recommend to increase the dental rate. But that increase in the dental rate reduced the buying power for all those people on Medicaid who exist under the cap. We proposed in the House that the cap be eliminated, the $1,000 cap, and the administration came back and said budget neutral. They could support increasing the cap from 1,000 to 1,500. I want to note that only 3%, 2.99% of people on Medicaid reached the cap in 2021. And while we appreciate the raise of the cap to 1,500 to maintain the buying power, we think the cap continues to be a real issue for Vermonters.
Okay, but you're not making a specific recommendation. I talked about yesterday or the other day in committee of raising the cap to 2,000, so maybe it's something we should think about.
I think that kind of a proposal would very much help. I also recognize that there is intent language in the budget that asks the administration to consider eliminating the cap in 2 budget years out. But that kind of a step is exactly what we're thinking about. Thank you, Senator.
Well, thank you. Okay, this is good. Under time, which is good because we need the time and we appreciate your work. All right, so Chad, is it Viger or is it Viger? Chad Viger?
Vijay.
Vijay, excuse me. All right. Please go right ahead, Chad. Thanks for being.
Thank you, Chair Lyons and the rest of the committee for allowing me to testify today. My name is Chad Vijay. I am the CEO of Recovery House. And I'll try to make this brief as I know we're under time constraints, but just for a little bit of an overview, Recovery House includes Serenity House, which is a 34-bed residential substance use treatment program, which includes detoxification and treatment services. We also have Grace House, which provides a lower intensity residential treatment model. We also hold the Rutland and Addison County public inebriate programs that offer safe beds to those who interact with law enforcement while intoxicated. And our McGee House, which is currently vacant, is hopeful to add 16 beds at the lower intensity residential treatment level of care in the near future. But I'm here today to talk about 3 budget requests that we have. The first of which is a one-time appropriation of $50,000, and this is to increase our admission staff by 1 individual. And the intention behind this is to reduce the time between someone's first call and their admission into our program. We really want to strive to get people into treatment as quickly as possible, while also recognizing that it is a bit of a process on our end to make sure they're appropriate for our level of care. The second appropriation request we have is for $300,000 one-time request for building improvements. 2 of the buildings, Grace House and Serenity House, are both late 19th century buildings that have over the years been deferred in terms of maintenance. We operate at 95% Medicaid population within our facility, and the reimbursement rates, don't allow us to focus on things outside of clinical patient care. And so for the 50 years of service that we've provided to Vermont, there are a lot of things externally and internally that would need to be improved to help with energy efficiencies, weatherization, improving kitchen fixtures, repairing roofs, and upgrading furniture. So we do have a need that we would like to upgrade and provide a more welcoming environment to those that we're serving. Our third request is a reimbursement rate increase from Medicaid. A few things that I'd like to point out is that we operate on an episodic model, residential services do. But for the first 3 days while someone is here, if they leave within those 3 days, we get a daily rate. And right now, on average, that daily rate is about $237. We're requesting to increase those short stay reimbursement rates to $1,000 a day. And this is based on, the beginning of someone's stay is often included with detoxification services, medical withdrawal management, and Medicaid has entered into contracts throughout the state with other providers in the past that $1,000 a day rate for detoxification services. This is what we're seeking as well. We have to be able to cover our medical costs. The second piece that we would like to have considered is continued stay funding for those needing longer lengths of stay within our service. Our episodic payment structure on average provides about $260 a day. And typically our program is a 2-week program, although folks might have a clinical need to stay longer. The issue is when folks stay longer, the episodic payment does not increase. And essentially it drops the daily rate to a figure that's not sustainable. So we are requesting for some help in increasing reimbursement rates to make our model more sustainable rather than relying on grants. And I appreciate, these considerations on all three requests that we have.
Thank you. Perfect timing.
Thanks.
Good. We have a question from our joint fiscal.
So the last one, the reimbursement rate increase. I'm trying to figure out what that translates to in terms of this will last. So you're increasing the rate, but what would that total be? Like, how much did you receive last year? What do you think that $1,000 would be? I need to have a number for them to put into the budget. You know what I'm saying? I don't know how to translate that.
The last budget in fiscal year 23 was a 5% increase written into the budget. I don't believe there was a figure associated with it, but I can get a figure and report back to the committee on that.
Yes, please do. Send it to Alex and he'll connect it with our joint fiscal office.
Okay.
That's great. Yeah, thank you. Anything else, Nolan?
No, that's perfect. Thank you.
All right, we're good. Thank you all. This has been very enlightening and also very unenlightening and at the same time, or depressing. Yeah. The needs continue. So our committee Helen's going to be putting together the sheet that we worked on in previous sessions, and we'll come back and look at this. I guess my suggestion would be to consider those things that are so critical for prevention at every level of life. It's hard to take anything out, but also those things that we might want to prioritize. And as I said before, we'll hear from joint fiscal on what is currently in the budget and look at how this all balances and sugars off with the work that we've done in here. And then we'll try to put together a short recommendation for the Appropriations Committee on behalf of our committee. This is not an easy job. Thank you. And we'll go one question.
We can go on.
Yeah.